Race Talk with Lane and Eugene is a curated conversations about race in the United States. This week, the topic of discussion is distrust of the healthcare system in communities of color and how that affects the efficacy of the COVID-19 vaccine.
All right. In the meantime and in between time, Happy New Year, everyone. Everyone to Happy New Year and a Happy New You.
Good morning. Good morning.
Welcome back. So welcome to the third, I call this the third round of Race Talk with Lane and Eugene. Race Talk is a platform where curated conversations about racism and race issues in the U.S. take place. Lane and I, started doing this because of the fact that we were ourselves wanting to do more, and so this platform has been created truly spirit guided for sure. But the one thing, and I say this every week, that most important thing about Race Talk with Lane and Eugene is your voice matters. Your voice matters. And so for those of you who this is your first time here, I am Eugene Holden. I'm your co-host here with Race Talk with Lane and Eugene. I am a licensed spiritual practitioner. I facilitate workshops. I work with groups, work with men, work with couples, work with women. I work with anybody and everybody who is looking to dive deeper into themselves, to then express themselves at a higher and greater level. Lane?
Yes, welcome everyone. We're so glad that you could be here, that you've chosen to join us once again. Welcome all newcomers. My name is Reverend Lane Cobb, and I am an interspiritual minister and ordained at One Spirit Learning Center Seminary in New York City. Before that, and now I am also a life and business coach, specifically working with women, and I have also been a wellness coach for women. So I actually have a 360-degree approach to wellness, specifically helping women work through transitional issues and find balance in their lives. And so that is what I do. I'm so happy to be here. Certainly, we will have a discussion following Eugene and I sharing some information with you. Just wanted to say that for our newcomers that this is a safe space for everyone to share. This is the non-judgment zone. Eugene and I started this because we felt like we needed a place to actually express ourselves and kind of learn from each other. We wanted to start a series of conversations about race issues in the United States as a way to facilitate healing for all of us, not just people of color, but all of us here in the United States. And that we felt that everyone needed that space. So here we listen to each other, we learn from each other, and we agree to disagree if that's something that has to happen. The topic for today is going to be something that's on everyone's mind here, which is the coronavirus vaccine. So, and I'm assuming it's on top of mind, but you can't help it. And so we wanted to talk about that, but in the context of the fact that there is a historic distrust of the healthcare system among people of color here in the United States. And that is for quite a few reasons. But we wanted to go ahead and have that conversation just because it's a salient issue. We're trying to promote herd immunity. We're trying to do distribution. We want everybody to have access. And so we thought that this would be a good opportunity to discuss this topic. One of the things that we do not have is a speaker to talk about this in a firsthand way. We do plan to have someone coming in at one of these series or sessions in the next 8 weeks to talk about their experiences, someone who works in healthcare. And then again, of course, as I said, we're going to have a discussion afterward and perhaps talk about a question or two about how can we make this better. perhaps what can be done to make the healthcare system more, do more of what it's supposed to do in terms of serving everyone. Um, and so at this point, I'm going to go ahead and turn it over to Eugene, and he's going to give you some historical information, and then I'll come back and give you some more current data, if you will.
Thank you, Lane. So, it's an interesting thing here in the United States when we talk about healthcare and the African American population. Historically and generally speaking, Black people are kind of hesitant about going to the doctor, about getting cared for in that way. And there are a number of reasons why. And I'm only going to speak about two of them this morning. And the first one is the Tuskegee study, which was happening it started in 1932. And in the Tuskegee study, it was about, it was really a study of untreated syphilis in the Negro male in Alabama. Now, here's the thing about this, right? The purpose of this study was to observe the natural history of untreated syphilis in the African American men. And those men who participated in that study, they were told that they were receiving free health care from the federal government of the United States. They were never told what the study was really all about. And they were also told that it was only going to be for 6 months. This study and this thing went on for 40 years, from 1932 to 1972. And so as news got out about this throughout the years about what was really going on, that brought forth a distrust. That was one of the reasons why that brought up a distrust of the medical services that were given to African Americans in the USA. It was interesting that, as I had mentioned, it was only supposed to be for 6 months, and it went on for 40 years. But after the funding for the treatment was lost in the study, but the study continued without funding, or let me put it this way, the funding continued without informing the men that they would never be treated for the syphilis. None of the affected men were treated with penicillin, despite the fact that by 1947, the antibody, the penicillin was widely available and had become the standard treatment for that particular disease. But the African American men in that study never received that, right? So this is one of the reasons why, generally speaking, I'm saying generally speaking, the African American population kind of is a little hesitant about getting treatment. Another interesting thing, and this is really a powerful thing, and that is the case of Henrietta Lacks, Lacks. So in 1951, this Black woman named Henrietta Lacks went into the doctor for vaginal pain. Well, they found that she had cancer, and so doctors took the cancerous cells from her for study without her consent. And then they found that her cells, her particular cells, instead of dying like a lot of the cells did when they transferred those cells to a laboratory, in that same lab, they use the same lab all the time, instead of those cells dying off, they found that Henrietta Lacks's cells would populate over 20 to 24 hours. They just kept expanding, they kept growing. So as a result of that, that establishment then created what they called the HeLa, HeLa, cell line, which today supports a multi-billion-dollar biotechnology industry. Right now, again, Henrietta Lacks she didn't give her consent after she passed away. And for decades, the family did not see any financial compensation, and they were not consultant on other medical decisions stemming from the use of the cells that they used in research. So this is just a couple of the instances where that have come up where with the African American population has a hesitancy getting medical treatment because there's this distrust, and there are other reasons why as well. And I think we're going to talk about that. I think Lane may be talking more about that. Here's one more thing I want to share in terms of the information. Oh, no, that's not it. So when we talk about, here we are with the vaccine that is out, and there's this argument, or there's this conversation going on, generally speaking, generalizing again within the Black American community, whether or not to get the vaccine. It's an interesting thing that we an interesting place that we find ourselves in, and we'll talk more about the impact of the African American race not getting the vaccine. Is there anything else I want to say regarding that? Yes. So we talked earlier about I think it was in round one, our first eight-week session, about healthcare disparities. And so we are still here, right? We're still here. I mean, even today, we are looking at how, generally speaking, the African American race does not get, or even people of color, I just won't say the African American race, but people of color, generally speaking, do not receive the same quality of care. And it's not only because, and it's not just because, not only because they are low income. Studies have shown that people across the board, in terms of the economics, their jobs, the education, still the African American population still does not receive the same quality of health care as their white counterparts. So here we are in 2021. Yay! I'm so happy about that. And where this vaccine is being, distributed, and we have this conversation that's going on amongst people of color. Should we do it? Should we not? The establishment is saying, well, this is why you should, and we'll talk more about that. Cool.
Well, thanks, Eugene. One of the things that Eugene didn't say is that, and you may imagine, that the Tuskegee experiment, here's what, when we speak to many of our African American in our communities, and we talk about healthcare, and we ask, hey, how do you feel about this coronavirus vaccine? What do you hear a lot is, I'm not getting it. Tuskegee experiment. So that's like the thing that most people do go to. Tuskegee experiment, Henrietta Lacks. To this day, there is a healthy distrust among the Black community in Baltimore, where Johns Hopkins is, because that's where these experiments on Henrietta Lacks were conducted, and who was doing these studies and selling her cells, basically. The truth is that distrust of the medical community it really has long roots. So since slavery, right, Black bodies have been used for medical research, right, without anybody's consent, obviously. All right, women have been sterilized. Slaves that, considered to no longer be of use were turned over to the medical community. All right, here, you can experiment on this person, whatever it happened to be at the time. This is well documented. So this isn't theory. All right, this is well documented. And there have been books written about this. So clearly, I will look up some of this information. I will send you some of the resources that Eugene and I have been using for this episode in our follow-up email that you should be getting in a couple of days. So this is a long, healthy history. And, one of the studies have been done by Kaiser Family Foundation and Stanford and NIH and Johns Hopkins. Like, there are a lot of organizations very well known and respected that have been doing these studies about why African Americans, the healthcare disparities and the disparities in accessing the healthcare, and also the disparities in treatment, right? So Eugene touched on this a bit. One of the things I want to say is there is a statistic out there that says that 50% of African Americans polled say they are not going to get the vaccine. And that's huge. I mean, it's huge, right? And so what's missing, right? What is it that's having these people say, I'm not doing this? There are people that say, oh, no, I don't trust it because the government pushed it through too fast. The government is not taking our needs into account, and they haven't ever. They are trying to rub us out, like they want to eliminate us. So they're just going to give us this vaccine. It's really not good for us. Our bodies are different, right? Given the administration that we have, we know that this is a racist administration, therefore the vaccine comes out of there. Why should we trust that? And there's a lack of information going out to the African American community. We don't read, depending on your economic situation and depending on your level of education, depending on who you speak to, the information that you're going to have about coronavirus in general, let alone an actual very complicated vaccine, is not going to either reach the African American community or is not going to be understood fully by the African American community. All right. So, and it's not through any fault of theirs, it's the way the system is set up. All right. So Eugene mentioned this a little bit. Physician implicit bias is huge. All right. So they're just starting to figure out that they have to teach cultural competence in medical school. They have to emphasize this. It can no longer be an elective, right? And not only does it need to be in medical school, it needs to be all the time present, right? Mandatory cultural competence, because there is stereotyping. So there is evidence that particularly with pain management, care in the emergency facilities, Black people are looked at as, oh, don't worry about it. All Black people have high blood pressure, right? Oh, they don't need the drugs. They're going to sell the drugs. They're going to misuse the drugs. They're going to get addicted to the drugs, right? So pain management, they don't get the pain management that their white cohorts would necessarily get, right? Because of the stereotyping. Interesting enough, there are language barriers as well, right? If you are coming in and a doctor is talking in a language you don't understand, right? Not in a language, but terminology, right? For example, and you don't really understand, but you know that's the doctor, all right? There are times where you're just going to do whatever the doctor says. You're not going to argue about it. There's very little self-advocacy, right? Because there's not that middle, there's not a liaison. People don't know how to advocate for themselves in the medical system. Okay, so this is, some of the barriers and why historically now African Americans, people of color, have a distrust. We are not taken care of, right? So also it's an interesting thing that certain populations get a standard drug for whatever is ailing them, all right? There's a standard drug. Now, as you know, standard drugs are not, it's a standard drug, but it doesn't fit every person, right? So there are genetic differences, yes, in different ethnic populations. And yet these need to be studied more frequently and more fully, and not just kind of like, these are the drugs that we give African Americans. Very interestingly, many of the studies have found that a lot of the inequity has to do with heart problems, which is interesting, right? People coming to the emergency room with heart attacks are not considered an emergency. It's like, oh, you're having a heart attack. You just, have indigestion. Hold on a minute. You can sit there in an emergency room. It's going to be all right. All right. So these are studies that have been done. Again, you can find these. I will send you some links. I'm not going to offer a lot of statistics. We want to get on with the conversation. However, there are certain also, there are procedures sometimes that are not offered to people of color. Maybe it's an economic thing, but a lot it is implicit bias. Okay, so but it is all of these things combined, right? So if there's systemic racism in all the other systems of the of the United States, I'm just going to be general, right? Because you all know what I'm talking about. Why wouldn't it be in the healthcare system? Okay, like why wouldn't it be there? Okay, and so I want to just say that I'm going to read something in just a moment from someone, because I don't want to go on and on about this. And this happens to be a doctor of psychiatry who's offering some general information in his experience. But what I want to do is I want to point out that Black women, and particularly Black mothers, are among the least served in the healthcare system. Now, if you can get that, if you can imagine that being true, why would that be true? Why would that be true, right? Is it that they can't advocate for themselves? Is it that they get sick of stuff and just walk away? Is it that doctors see them and see them as something different? Black women are often considered less valuable, and this is across the board. So you're talking about in employment, right? You're talking about in housing, talking about in just schools, the way that Black girls are treated, right? So this is all over the place. And so in the medical community, they are considered something other than. People have opinions about parenting, right? Black mothers don't take care of their kids. They don't care about their kids, whatever that is. The prenatal care. So it's not just that Black people don't go and get medical care, although that is a big part of it. It is that when they get there, they are not taken care of fully. And so these things, this conflagration of things, the history, the current experiences, the lack of information, that all kind of comes together to create this distrust. So I just wanted to just briefly again read this, what this person says, and this is Dr. Corey Williams, a doctor of psychiatry at MedStar Health. One of the things that I'm reading is that people of color, and not color, everybody is more likely to share and accept treatment from someone who is of their own ethnicity. You're sharing your information, your stuff that you wouldn't tell anybody, you tell your doctor. So African American males in particular have been polled and just said, yeah, and it's the studies that have been done. When they see a doctor who is also African American, they are willing to get preventive treatment like flu shots, right? They're willing to get treated, take the meds that they're prescribed. So it is, and this is everybody, white people, Black people. If you're talking to someone who is of your own ethnicity, you feel understood. You don't feel judged. And this is particularly important for African Americans. And one of the issues is there's only 4% of physicians in the United States are Black. 4%. So the likelihood that you're going to be able to see a Black doctor, depending on where you live, is not very likely. So again, this has to do with the disequity in economics, education. It's all connected, all right? So Dr. Corey Williams is a doctor of psychiatry at MedStar Health, and he writes this, and then I'm going to close my little piece here. As healthcare professionals, this is the cultural and social genealogy that we have all inherited. It is no surprise that Blacks do not trust doctors or hospitals. Despite trends in the reduction of racial prejudice over recent decades, the marginalization of Black Americans takes place at every level of the contemporary medical system. In my work as a psychiatrist, I often observe the differential treatment of patients based on race or ethnicity. This discrimination may take the form of differential prescription patterns at times or increased restraints used in the hospital. I have observed hospital staff insistent that certain Black patients were dangerous, requiring 4-point restraints, which meant that each of the limbs would be strapped to the bed. In my own research, I have found that Black Americans with mental health diagnoses are less likely to receive certain medicine for their conditions compared to whites with the same condition. Blacks are less likely to be prescribed newer, better tolerated medicine called atypical antipsychotics. Rather, they tend to be offered older medicine with worse side effects. Specifically, a drug called clozapine, which is considered the Cadillac of psychiatric medicine because of its superior effectiveness, is prescribed less in minority patients with serious mental illness when compared to white patients. From the time a person enters the waiting area of an emergency room or clinic to the time spent with the doctor, as well as the doctor's treatment decision-making, is all influenced by race and ethnicity. One study of emergency room records indicates that Black patients are more likely than whites to receive lower triage scores for the same complaints, meaning that triage personnel rate the complaints as less serious. As a result, less serious complaints in emergency rooms translates into longer wait times. Even in case of serious medical emergencies, such as is the case of stroke, where time to intervention is critical, Blacks experience long wait time for stroke medications. After long wait times, when minority patients are finally able to even see a physician, several studies have shown that physicians spend less time with Black patients when compared to whites and are less likely to perceive the patient as being honest regarding their symptoms. The medical community must address the real sense of suspicion, distrust, and cynicism that is deeply embedded in Black collective memory. Earning a patient's trust is a very difficult feat, given these historic forces, but medical education systems, hospitals, and physicians themselves can take steps to address this issue. So Eugene, is it time to have a conversation?
Well, yes, it is. And I also want to, first of all, thank you, Lane, for bringing that forth. And yes, let's have the conversation. And when we talk about, the vaccine, and we want to get into the what they call I'm going to call it the community immunity as opposed to the herd immunity, because that plays a really significant role in what's coming up in terms of the vaccine. But yes, let's go ahead and open up the floor for a conversation, because your voice matters. Adine?
Can you hear me? I'm on my phone. Can you hear me?
Yes.
Yes, Adine, go ahead, and then I'm going to have Joe, because Joe hands definitely was up, okay? That's all. Okay, Adine, that's cool. Go ahead.
Thank you so much for being back. I've waited for this. This is very good. I have two things to say. First of all, in a culture which has devalued us since the Emancipation Proclamation, once we no longer had the value of making white slave owners rich, we have had no value. So we have been discounted and disrespected in all areas of the culture, and it should be of no surprise that we are discounted in the medical profession. I'm a breast cancer survivor. Because I am educated and fairly sophisticated, I have been able to take care of myself. When I was first diagnosed and after surgery, the first medical center I went to for treatment treated me so shabbily, with such disrespect, that I walked out of the door, never came back, and found a respectful oncologist. As a result, I have worked along with this medical center in New York City to speak whenever I have a chance to groups of women of color, talking about the importance of being in clinical trials, the importance of following through with treatment, the importance of not giving up. So what I'm saying is that those of us who are able should be out there talking about the vaccine, talking about self-advocacy, and supporting people of color as they struggle with this medical system. As a special educator, I work with minority parents, helping them navigate the medical system with children with multiple disabilities, because I see how these parents and these families are disregarded and disrespected.
Thank you. Thank you. Joe?
Thank you, Lane. Um, I wanted to make my comments about trust, and then about opportunities for people on this call to act, and in particular in regard to the COVID-19 vaccination. And thank you very much, Lane and Eugene, for the background. I think that was very, very helpful. To me, this issue of trust is critical because there's important information to be shared right now on COVID-19, and for many reasons, many parts of the population don't trust that information because of past history with that Eugene explained about with the Tuskegee situation. There's some real issues with trust. So let's assume that some people out there, marginalized folks, some of them want to have the vaccination, and for others, they don't want it for good and solid reasons. So how do we make sure that the people who want the vaccination get the information and have the opportunity to get the vaccination? Those folks may not be reached by traditional communication. They may not have internet. They may not have Wi-Fi capability. They may have language barriers. Those folks are talking to their friends and they know the vaccine is out there. They want it, but they're not sure how to get it. They don't trust their government to put it into their hands. Who do they trust? I suspect they trust their faith communities. I suspect they trust a local community center, like here in White Plains, we have the Slater Center. I suspect they trust that staff. And they may trust schools. So here's my call to action, or my suggestion. Each one, for those, and I see a lot of faces on the call that are part of the UU denomination. For those of us who know our congregation, and we understand there are people out there who may want the vaccine, but we're not sure that they're getting that information, perhaps we can do it, maybe we can form a network, and maybe we can take action and make sure we reach out to everyone in our congregation and make sure those who want the vaccination but need help in getting it have their voice heard, and we can help them.
Thank you, Joe. Yes, Tyrone. And Joe, let me just say this. You might imagine, you might suspect that the African American community would trust their faith leaders and their local healthcare clinics and so forth. You might imagine that, and that is, you cannot assume that for sure. And this does need to be, you're right, a campaign to specifically speak to the concerns of the African American community. We cannot expect that just because we put this over here or we have this conversation, it really needs to be like a big effort. And thank you for saying that, because you clearly know that it has to be multifaceted. Yeah, thank you.
Good morning.
Sorry, Tyrone, hi.
Hello, beloveds. Hope everyone is doing well. Thank you, Joe, for your comments. I want to make 4 points, if I can, real quick. One is that the testing of the drug. I'm not sure a lot of Black folks are convinced that there was a large enough sample of people of color used for this testing. And I think that's having a very big impact on people's decisions to take it. At least it's having an impact on mine. And so I need to do further research on that, but I haven't heard a lot of news stories about it, and I'm curious. I only maybe 1 or 2. So that's something that I think might is tied to the hesitancy of taking this vaccination. The other thing I want to go back to is the impact of doctors and the medical community, like you were saying, Lane. And two things. One is that there are incredible wait times for people of color and African Americans when they go visit doctors. Now, it's a generalization. I know it's not true for everyone, but I have noticed that. And frankly, I went into, I live in Oakland. I used to live in Oakland. I went to a center that was owned by an African American family of doctors. And it looked like every black folk in town was going to see this doctor because they trusted it. He'd been around 30, 40 years, 50. His son was a doctor. But I sat in that office 2 hours, you know, and I was, you know, I was doing my executive leadership role. I didn't have 2 hours to spend. I literally said I had to come back for that. And so I'm just saying that that's a concern, especially with working people. They don't have time to do that. It's like going to school to deal with your kids' stuff when you got 2 jobs you're trying to work. It's not an easy thing to do. The other thing is medical advocates. 2 years ago, 3 years ago, Eugene knows about this. I went through a rare but a very serious kidney disorder. And I formed a medical team, spiritual team, exercise team, nutrition team of people to support me. And Eugene was one of those people, part of my spiritual team. And I remember going to the doctor, and I was blessed with this brother, Dr. Robert Harvey, retired internist, is that it? Internal medicine, I forgot how to pronounce that correctly. But he went with me to the doctor's appointment. And it was amazing. He said, I'll be your medical advocate. And doctors talk to doctors very differently than doctors talk to patients. So I'm a big fan of medical advocates to tap someone to go with you or have a conversation. And the last point I want to make is politicization. I think there's a couple of reasons why people are not wanting to take, and it's interesting because they're on opposite sides of the camp. There's one camp it's been so politicized, thanks to the former president, of all the nonsense and his perspective about, you know, wearing masks and social distancing and all that stuff. And that's one reason that a group of people are not interested in taking the test. Both of them kind of stem from not trusting the government, but it's like coming from 2 different points of view. And no matter what point of view, it's all poisonous, you know, unless it's really looked at. So trust, so targeted marketing, it's going to be very, very important. They have black folks talking to black folks about this. They have Hispanic, Latinx talking to Latinos about it as well. This is going to be important. They got to be drilled all the way down to the family level. It's the only way it's going to really work. Family got to talk to family about it.
Thank you.
And get on the same page. I'll stop there. But those are 4 points I wanted to make.
Something that, and I think Eugene has unmuted, he might have something to say too, but something that came out, the tail end of what you said was, yes, in the Latinx community, they do have Latinx people talking to Latinx people because of the language, right? So they want Spanish-speaking people to talk to Spanish-speaking people, yes, but where does that leave us, right? We speak English. We're born here, right? And so there's an assumption that we should just, you know, get whatever everybody else gets. We should understand what everybody else understands because everything is in the public domain. It's already out there. How come we don't understand it? How come we don't know it? And maybe it doesn't matter. We should just go along with things. The other thing, Tyrone, you said was that we need to have more of us in research studies. And of course we do. But however, researchers do say it's very difficult to have people of color participate in research studies simply because of that history. They don't trust. What are you giving me? I don't know. You're giving me something, I'm gonna give it. You're not gonna tell me the truth. Yeah.
A mean cycle. It's a mean cycle.
It is a mad cycle.
Because of the Tuskegee stuff that impacts people who won't even be selected to take tests, which creates a larger problem down the road when you do want to take the vaccination because you don't have
it's a cycle.
You know, solid results. So it's a vicious cycle.
Eugene, did you want to say something? I do see a hand, but did you want to say something?
Yeah, I saw Frank's hand, and I think I'm going to say what I want to say after Frank speaks.
Thank you, Eugene. just many of you don't know me. My name is Frank Mastores. I'm a practitioner with Centers for Spiritual Living, but I'm also a registered nurse who works currently in intensive care. I am currently contracted to NIH, so I'm working with the National Institute of Health. Research is difficult in many respects. Many people are afraid of research for a number of reasons, because of course you don't know what's going to happen once you receive a specific drug. And it's scary. As I have worked looking at this vaccine, I have coworkers, so even though NIH was involved with helping to develop the Moderna vaccine, I have coworkers who won't take it. And these are licensed nurses, licensed doctors who refuse because of the political issues that came up because of the previous president, the speed at which it was developed. And in many respects, this is an emergency use. I've had my vaccine. Some of my coworkers said to me, and quite literally, Frank, you first. I want to see the vaccine work on you, because they're just scared to death. Doctors, the history goes back to, as you mentioned, Eugene, with the Tuskegee Airmen. There was no control of research or any control of the purposes of research. With the Tuskegee Airmen and then the World War II, with all the experimentation on the Jews by the Germans, what came about was called the IRB system. All research, all legitimate medical research has to be first approved by a general medical body that looks at the purpose and what it is. Many research projects do not get funded, or they are not approved because they are not even going to be effective. So now in order to get any research, any legitimate research going, you have to have a research board that actually approves the research, the purpose, all aspects of it has to be observed and looked at completely before a legitimate research project can go forward, and in many respects gets funded. Number two, doctors in and of themselves, and medical staff, nurses too, will talk in medical jargon. That's a huge problem, not just for African Americans, but for everybody. There are so many times I've had the doctor will talk to the patient, and then I'll have to explain it to them because they don't understand. The doctors don't understand. You got to keep it simple. Talk in simple terms, because no one speaks medical. Sometimes, though I've been a nurse for 27 years, there are times doctors will say something and I have to go look it up because I don't know what the hell they said. Okay, so it's not just you, it's me too. Okay, as a nurse who's been practicing in intensive care for 22 years, 27 as a nurse in general, I have to look it up because doctors talk in doctor and in medical jargon. My suggestion, and this is to keep it, is to give you a better idea of what's going on. Both the Pfizer and Moderna vaccines work on what they call the RNA of the cell. What it does is it causes the RNA to sense and know if you should get the virus, to sense and know and turn on. It does not change the system. It acts like a signal to get the cell's sensors to activate when you get the coronavirus, to get your immunity system to activate. At least those two vaccines. There are many more coming along the pipeline. I cannot speak to them, but in speaking to people, my suggestion to the faith communities and to everyone who is out there, that the current vaccines do not change you. They get your cells to activate to sense and know that you have the virus in you. And so your immune system will activate and turn on. But keeping the language simple is one of the best ways to get everybody vaccinated.
Yeah. Thank you, Frank.
You're welcome.
Yeah. Thank you. I see your hand up there, Edward, but I'm going to throw a curveball here. And this still has to do with the vaccine. And I'm taking this from a page, it's called The Conversation, and what's not being said about why African Americans need to take the COVID-19 vaccine. So let me just read just a part of this. Dr. Anthony Fauci and other national health leaders have said that African Americans need to take the COVID-19 vaccine to protect their health. What Fauci and others have not stated is that if African Americans don't take the vaccine, the nation as a whole will not get to what they call herd immunity. So let me talk about that just a bit. This is what they call doing the coronavirus math. About 70% of people in the US need to take the vaccine for the population to reach herd immunity or community immunity. Whites make up about 60% of the US population. So if every white person got the vaccine, the US would still fall short of herd immunity. A recent study suggests that 68% of the white people would be willing to get the vaccine. If these estimates hold up, that would get us to 42%. African Americans make up more than 13% of the American population, but if up to 60% of African Americans refuse to take the vaccine, as recent studies suggest, as they write here, it will be difficult to reach that 70% threshold likely needed to reach community immunity. So there's a lot here in terms of, educating not only, the Black community, but, people of color, across the board. And we are faced with, these blocks of fear, right? These blocks of fear and mistrust. And the only way I think, to break through those is education, education, education.
So my turn?
Ooh, man. Who said that?
Edward. Yes, Edward, it's your turn.
Hi,
Yes.
thank you so much. And now that I listened to Eugene, I'm going to say not what I planned to say. So I've been grilling people around me that are scientists, that are doctors, that are nurses, that are knowledgeable in this vaccine and discussion about the coronavirus. And this herd immunity, I keep asking, what is this herd immunity? There are all the statistics, and I certainly agree that what Eugene presented is better statistics than I've heard, and I'm certain it's correct. But herd immunity, there's no magic about herd immunity. These are all percents. What it really comes down to, what's the likelihood that a person who has not been vaccinated comes into contact with a person who has or has not been vaccinated? So I don't care what the percents are. If there's a person walking through the community that hasn't been vaccinated that's carrying coronavirus, and you haven't been vaccinated and you happen to deal with that person, you're more likely going to get sick. And I'd love people to challenge me on the correctness of what I just said. That's what I kind of forced out of my, I'm not a scientist, but out of the science people around me. I believe that herd immunity is only about reducing the likelihood that you're going to get sick. But if you don't get vaccinated and you happen to bump up against another person who hasn't been vaccinated, and one of them is carrying, you're likely going to get sick and add to the horrific, hospitalization and death statistics that are out there. So you can hear that I'm an advocate for getting the vaccine. So now, what I planned to say was that I entered into this process as a person who is a proponent of getting vaccinated. I also happen to be, I want to thank Joe Majak for introducing the need for people of our faith, Unitarian Universalists, to get active out there and engage and make this better. A number of us, including Joe and about probably more than a half dozen people on the screen right now, are active in the NAACP. I am active in the NAACP. I am one of very few white leaders involved in the NAACP. I try not to be a white leader in the NAACP. I want to be around, I want to help, I want to support. I don't want to be in the limelight. I don't want to be the white male leader in a Black organization that is predominantly women. And so I constantly work against that. Nonetheless, I happen to be chair of the health committee of the Peekskill branch of the NAACP. I've been involved with that branch for about 6, 7 years. So the people know me pretty well. I know them pretty well. We are friends in many respects, have great affection for one another. So I burst on the scene, pushing small group discussion and then checking in with others, this plan to bring education to the communities served by the Peekskill branch of the NAACP. And so I checked in, I thought I was on track and whatever. I came to the executive committee and I was blasted. I was the only, one of few white people in the room at the time. And I was blasted by people who know me and know me well. And I kind of, felt step back a bit, and people immediately were apologizing. Oh, Eddie, please don't go away. I'm not going away. Don't worry about me. But I put my plan on pause because it obviously wasn't the right plan. So I spent about a month and a half since that event trying to figure out a method to help the education happen in our community. And I fell on something. I and my committee fell on something. So we tried it out in our committee. So I had 4 stimulus questions about the vaccine. And we were preparing for this. I put the questions out for like 4 weeks, the meeting before and in the middle and till our meeting. I want you to focus on 4 questions. The first one is, what is your personal history related to getting vaccines and this? The second was, how do you want to learn more? And others, how can we package this and make this a program? We never got past the first question. I never got past the first question, asking the question. And this room full, so we were 9 people. I was the only male and the only white person. I said not another thing. And knowingly, I'm surrounded by combinations of people who have a clinical experience, clinical knowledge, nurses, physician assistants, many other, all from the health industry. And I didn't need to say one more word. And it was an intense discussion about this vaccine. People sharing all the concerns that have been addressed and more than today. Said not a word. At the end of the session, they suggested taking a poll before and a poll after. The poll before, how many people are going to get the vaccine and fairly split. That 50% number feels about right. And then in the second poll, what it came down to was everybody had taken a step forward in understanding. I don't know that a lot of people went from I'm not taking it to I'm taking it, but each person that said I'm not taking it said I have something to think about. So just by happening the next night, this is the end of my story. I've been taking a long time, I know. So the next night, I asked my committee, can we do this in the general meeting? So it was 9 people in the committee meeting, ended up being 37 people at the general meeting, vacation week and a lot of people away. And I said, I can't chair that. A white person cannot moderate that conversation. So, nobody in my committee was willing to step forward. I said, how about the president? Everybody loves Valerie Eaton, adores her, including myself, the president of the Peekskill branch. What'd she do? It's a great idea. It's great idea. I said, listen, I have to ask her. I asked her. She said, I don't know about this health stuff. I said, Valerie, I'll give you the questions. And all I asked was that you start with a personal statement. Anyway, this is the end of the story. With 37 people in the room, the same intense discussion and the same sense at the end of the discussion that everybody move forward a little bit toward willingness, interest, desire to take the vaccine. So I end my statement by saying this is all about trust. There's
Yes.
a lot of other stuff. Everything that has been said so far is true, but at the core is trust. And without finishing the, there's a greater trust about people who know each other, people in this or in the
Edward,
know each other.
Edward,
Yeah.
I need to jump in here because we are out of time here, and
I'm
that's
done.
one of the things that we've been speaking about throughout this time is that it is about trust. I know, Carol, you've had your hand up for a while. If you can keep this short, that'll be great because we do need to close this out, and I want to talk about who we're going to have for next week. Carol Johnson.
I could, but mine's not a COVID thing. Mine's a treatment thing. So I can.
Thanks, Carol. Let's leave it. Let's table it, Carol, if that's okay with you.
That's fine.
Great.
Thank you so much.
Yeah, this is everybody, thank you so very much. For those of you who have shared, thank you so very much. Edward, thank you so very much. Joe, Frank, everybody. And for those of you who didn't share, thank you for being here, because this is what Lane and I love, is that we have these conversations for education and and clarification so that we can go out and do what it is that we are called to do. Next week, we are having Reverend Masander Hiraoka, who's going to talk about something that I had to look up, and it's called, oh gosh. I know, right? Oh, the model minority myth. The model minority myth, where Asian Americans are looked at as the model citizens in the USA. And he's going to talk about what that does within that particular community. Again, thank you so very much for being here. We love that you guys continue to show up, and stay tuned because we're going to keep expanding. We're going to keep growing. Lane?
Thank you, everybody. God bless you. Have a wonderful afternoon.
Everybody stay well.
Yes.
See you next week.
Stay safe. Wear a mask.
Thank you.
Stay safe.